He was a carpenter for a while, and then he went to work out at Farmland Industries and was out there for 30 years.
He probably fits the dictionary definition of grandpa. You know, when you say the word grandpa, he is what you would expect to see. He was just very loving, supportive of everything we did.
Dad liked to take a lot of weekend trips. We did a lot of picnicking and fishing. We tended to be rather rambunctious like most kids are. And so my dad told us that when we went fishing, we had to be quiet because otherwise we'd scare the fish away. There was a time that we went fishing. Shortly after we'd gotten there, this huge family pulls up in their car and they get out and they're laughing and talking and being noisy and just awful. And we're all looking around like, oh my gosh, they're gonna scare all of our fish away. And they get their cane poles and they go out and they are hitting the water with their poles and laughing and talking. And they were pulling in fish after fish after fish, and we were catching nothing. So I think at that point, we kind of figured out that Dad's reason for taking us fishing was so that we would be quiet and not so much that we were going to catch a lot of fish, but it was an opportunity to spend time with us without us driving him crazy with all of our questions.
He also did a lot of woodworking, and all of us kids and grandkids have, you know, different crafts that he made, whether it was piggy banks or I have a little doll house. So all of us have these, you know, mementos to remember him by, which is really nice.
He was looked out for everybody else. I think he volunteered for about 15 years. They called him the odd job. And if they needed something done, they'd call him and he would go in and do it.
He'd had Parkinson's for a very long time.
Yeah.
And it was he'd probably had it 20, 25 years.
I don't know, if you didn't know that he had it there at first, why you wouldn't have known anything was wrong with him. He was shaky to start with. His hands shook a lot. We had home health aid, and he had speech therapy and physical therapy, all from visiting nurses. It was great because they could help him where I couldn't.
Mom was the primary caregiver, and so she was trying to do everything that she could to help. My dad was a big guy. He was 6'1", and my mom's 5 foot and an inch or two.
4. Don't make me any shorter than I am.
And so as he needed more help, we also had a CareLink unit installed so that if something happened to Dad, he could either push the button if he was home by himself, or if Mom was home and he fell, which actually did happen one time, she was able to push the button for him and direct the emergency respondents to come. My mom had a stroke. Actually, she's had several strokes. She's had total knee surgeries. And so during those times, we had our private duty program come out and stay with Dad overnight while my mom was in the hospital. It was really nice to have that extra support and help so that Mom wasn't trying to do everything all by herself.
And it was something that was very hard to do.
It was interesting to be on the receiving end of the care for a change, because having worked for VNA for so long, I've heard lots of stories. I knew we had fantastic staff, but it just reinforced that. They were very caring, they were very kind, they were direct but not unkind in sharing information about what we could expect. And so he was very peaceful, he was very quiet. The day before Dad died, Andy had been out and had seen Dad. It was just as difficult a time as it can be for families. I think they made it a lot easier because we knew he was receiving great care.
Just knowing that they were there and could take good care of him and make sure that he wasn't in any pain. He couldn't tell us what he wanted, but it was almost as though they could sense what he wanted, and they would take care of him.
You know, no matter how long I've been in the medical field, you know,
you know what to expect, but when it's your family, it's never quite the same as when it's your patient. And so having someone else there to support your family and give him the best care that he deserves, you know, was greatly appreciated. And having it be even my fellow staff members was even better because I knew them and I knew what great nurses and care providers they were. And
just having all of them there, and Jan, watching her, she was so gentle and tender. It was really sweet. We very much appreciated the care, the love that she showed to my dad, I guess.